again, we are at the 2022 Healthy Heart Fair right here at Nash UNC, and this is Sarah Heenan, Executive Director. Tell us all about it and what's going on here.
So we have a lot going on here. We've got cardiac rehab, we've got a dietitian, we have a heart failure specialist, we have lipid testing, blood pressure testing. You can talk to people from Nash OBGYN. They're here to talk about women's health and heart health with women because, women are a special category.
Absolutely.
So we can't, we're also raffling off an Apple iWatch.
Ooh.
So fancy, and we have a bunch of other raffle items too. So we really invite you to come down. This is your heart center. Take a chance to look at it, take a tour if you want to, and look at the services that we have here at UNC Nash Healthcare.
And we're here with Morgan, and she is from which department are you from?
Food and Nutrition Services.
Food and Nutrition Services. So you are here to make sure our patients eat right.
Correct. Yes, with a focus on watching their salt intake, their fat intake, and just overall, general healthful eating.
Do you help plan their meals while they're in the hospital?
We don't, but we try to encourage healthful eating and, do diet educations from time to time for those that we feel need it the most.
Okay.
So.
And how can what do you do generally as your job?
We see a variety of patients, assessing them for malnutrition and, ensuring everyone's eating appropriately and getting the right nutrition that they need to help get them healthier, and get them out of the hospital.
And we are here now with Lisa. And Lisa, you do heart failure education.
Yes. I do heart failure education for our heart failure patients here at the hospital, educating them on the disease process, teaching them about dietary changes, changing their diets, and just helping them manage the disease process in general, and just making sure they have resources available so that they can succeed in the community.
Well, education is very important because if you don't know what to do, you can't do it.
Exactly right. A lot of times you just don't know what you're getting into, and all this is new for the patient. They have no clue to where to start or even where to begin with this. So it's all new for them and a learning curve, definitely. They can reach out to our UNC Cardiology Clinic at Nash, Curtis Ellis Drive. That phone number is 252-962-2328.
This is Baja, and she is in cardiac rehab. Very important step when you get finished with your treatments. Very important to end up here.
Yep. So after people finish their treatments, they come to our outpatient cardiac rehab program here on the hospital's campus. And they use these wonderful machines here that we have for about 36 sessions to help them continue to build their heart muscles, increase their lung function and their breathing, and to get stronger muscles. It's great.
Yeah, sure. Okay. And about how long would someone go through the process?
Well, they usually come 2 or 3 times a week. So that ends up being, 12 weeks or so, sometimes a little bit longer. So our patients are usually with us 3 months or so, 4 months sometimes.
And your sessions last about how long?
About an hour and a half every day.
Hour and a half. Okay.
We do lots of wonderful education with them. They exercise a good portion of the time, but we teach them a lot too. Our nurses and respiratory therapists along with us do education every week.
Education is so important.
It is. Our patients are amazed, I think, from the time that they come to the time that they leave, how much they actually end up learning, not just coming in exercising and feeling better, but all the education we give them, all their signs and symptoms, how to eat better as well. We have a dietitian that we work with. Y'all probably talked to her. But
Yes,
yeah, they learn a lot, which is wonderful. We love to hear that and see that.
And we are standing here at the booth with Nash OBGYN, these nice ladies in the background, and this is Christy. Hey, Christy.
Hi,
You're a midwife.
I am a certified nurse midwife and a women's health nurse practitioner.
Now a lot of people don't know exactly what a midwife does. Could you please tell us?
Yeah, so midwives are basically, we're considered mid-level providers, but we are practitioners, providers. We deliver babies as well as provide primary care, women care for women of all ages. We do contraceptive care, perimenopausal, menopausal care, sexual health care, So we do a whole lot.
Wow. So you're a part of Nash OBGYN.
Yes, ma'am.
Okay, and tell me about the services of Nash OBGYN.
So at Nash OBGYN and Associates, currently we have 5 MDs, we have 2 midwives, and we have a women's health nurse practitioner. Again, we provide care for obstetric patients as well as preconception care, postpartum care. We do, women's care throughout the lifespan. So we do annual appointments to keep women up to date on their screenings, pap smear screenings, breast cancer screenings. We also do yearly lab work. So yeah, we kind of do everything. We do, consults for surgical care as well.
Wow, that's a lot. So you're really a full service women's gynecology and obstetrics, really.
Yes, we are. And, so we personally, as midwives and as women health practitioners, we do not do surgery. However, that's when we consult and work with our MDs on staff if we need to do any sort of surgical intervention, and they kind of help us out in that realm.
Monica, tell us what we're doing at your booth.
We are checking cholesterol.
Which is important.
It's very important.
A lot of people don't realize, the way we eat, we're in the South, we're in the East, and it's important to get it checked because of the way we typically might eat in this area.
That's correct. It's a huge risk factor for heart disease, so it's very important to know your cholesterol. Very, very important.
And I see you've had this gentleman over here.
Yes.
Getting his check today.
Yes, we're actually checking it right now. It's running. The test is running.
Yeah.
Well, we appreciate the service y'all are offering to the community today.
Thank you.
We really do.
That. Thank you.
Two very important people with the Heart Center and the Healthy Health Fair today. That's hard to get out. Is Erica Mountjoy. Hey, Erica.
Hi.
And Dr. Jagannathan.
Hi.
Tell me your role in this whole thing.
Yeah, so I am a cardiologist. I specialize in advanced heart failure and transplant, and Erica Mountjoy and we run the heart failure clinic here at Nash. So we take care of patients with heart failure. We assess patients that have more progressive and advanced heart failure and refer them for more advanced therapies like mechanical heart or transplant surgery. Patients that need extra fluid medicine. We also have an IV diuresis clinic where if they need that extra boost, we're able to give them Lasix through their IV to get that extra fluid off and then get them on the right medications. We see them frequently. We make sure they're on the right doses of their medicines and that they're feeling better and they continue to feel well.
Very good, very good. And Erica, what is your role?
I'm a nurse practitioner, and so like Dr. Jagannathan said, we work together in the heart failure clinic, and so I see patients for their heart failure, whether they've been in the hospital typically, and I'll see them outpatient on follow-up, usually newly diagnosed or continuing to follow them after they've been diagnosed to make sure they're on the right medications, their fluid is under control, they're feeling better. And she mentioned the IV diuresis clinic, which is what I do as well. Okay. So if a patient is, acutely overloaded, they have too much fluid and otherwise stable, we can offer the IV Lasix outpatient instead of sending them to the hospital.
Well, people know what stents are. They know what heart attacks are. What is heart failure?
So heart failure is when the heart muscle is weak for multiple different reasons. And one of the more common reasons is patients after a heart attack, the muscle gets weak. The other most common reason is high blood pressure, which is very prevalent in this country. So we try to explore what might have caused the heart failure, the weakened heart muscle, and we get them on medicines that help strengthen the heart function.
Absolutely. Okay, well, that's a good explanation. I know there is a difference in the two, the heart attack and the heart failure. So thank you for explaining that to us. And thank y'all for what you do, and thank you for talking to us today. It is so important to keep in touch with your health. Always attend events like this. We want to thank Nash UNC Hospital for hosting this today. They do this on an annual basis. There's lots of education to be had in the various, as you've heard, aspects of your health. So we do encourage you, whenever there's a healthy heart fair, please attend. Please attend. Get your numbers checked. It's a very good thing, and you can pick up a lot of literature. So again, please attend the healthy heart fairs.